My name is Megan. I was brought to the Neural Connection after a slew of really bad migraines where I was being impacted at work pretty significantly every day. And a colleague had a connection to the Neural Connection, and she suggested that I reach out. Life before meeting with the Neural Connection with my condition was pretty hopeless. Every day I would wake up with a migraine, not knowing if I was going to be able to work that day. As a mental health professional, that was really challenging. It was constantly being in pain while trying to address the work that was happening, and experiencing symptoms during the day and not knowing if I was going to be able to make it through that day. And then really not having a social life, which at my age is pretty concerning, and it can be really hopeless and just feeling like this is what life is going to feel like forever. My primary symptoms were significant eye pain behind the eye and one side of my face that would switch on and off, with significant aphasia, which is when it's like having a word at the tip of your tongue and not being able to say it, which it's really embarrassing. Also significant nausea, forgetfulness, moodiness, really bad depression and anxiety. I tried pretty much what I think is everything before I came to the Neural Connection. I tried trigger point injections, I tried rounds of Botox, I had a breast reduction, I tried different handfuls of different medication. I've traveled out of state. We tried to get me connected to the Mayo Clinic. Pretty much everything that we could think of as a family I tried before coming here to the Neural Connection. My symptoms have been chronic for 15 years before coming to the Neural Connection, which is just about half of my life. My experience working with the Neural Connection was life-changing. It was a complete different paradigm shift from every other medical provider that I've worked with before. From my first experience of meeting with Dr. Reese until throughout my treatment, I was cared for as a patient. I was listened to. It was clear that they were very invested in my wellness and my progress as a patient, and it was not about a paycheck. It was not about just giving me medication to push me to the next visit. It was about how do we really support this human. Life has changed a lot since my completion of my treatment. I feel like I have control over my life again. I feel like I understand for the first time what exacerbates my migraines. After 15 years of treatment, I had never had anyone explain to me what was really causing my migraines. And so it feels like now I have the reins to my life again, and I can make choices that I know will influence my migraines and really allow me to be in charge of my own healthcare. I would say to anybody looking, or anyone in my shoes looking for help, to try this. I think I was hesitant at first because it is something different than the typical healthcare model. I'm very privileged to be able to be in a space where this was an option for me. So I think I would say try it, and I would also say to their family and friends, support the individual in being able to access this help, because it can be so life-changing. I'm just extremely grateful for the Neural Connection and the way that they see humans and the way that they just really challenge the narrative of what healthcare looks like in the United States, and giving patients a connection where they can feel like they are in charge of their own healthcare and where they're actually getting better. And it's not just trying to put a Band-Aid on the symptom, but it's truly about addressing the root cause. So one of the big ways I would say that it's changed with my migraine treatment is I used to rely on my max dosage of Imitrex per month, which with insurance they give you 9 per month. Sometimes you have to wait and kind of decide how bad that migraine truly was. And after working with the Neural Connection, I was down to taking like 1 Imitrex a month versus sometimes capping out at 15 if I had stockpiled. And so I'm taking a lot less Imitrex. My diet has changed huge. Previously, embarrassingly, I was eating out multiple times a day because the pain had gotten so bad, and with the work that I do, it was just easier to eat that way. And working with the Neural Connection completely changed how I navigate life. I now make things more at home. I'm now more mindful of what I'm eating first. I think the big breakthrough in what Dr. Reese taught me was about how he was able to see that my migraines were so impacted by my blood sugars, which again, after 15 years of not having any doctor explain that to me, it's just a wild thought because your health can change so much. And something as simple as realizing that it was my blood sugar and coaching me and keeping me accountable on what my food intake was like and what my exercise was like really changed things. So I'm now taking a lot less Imitrex. I'm taking a lot less Excedrin migraine. I have more energy. I have more motivation. I have significantly decreased my anxiety. That I think was another really big takeaway, was able to be grounded, and I was able to not feel dysregulated in my body all day long.